Central Posteroanterior Cervical Spine Mobilization. What does the evidence say about cervical mobilizations? Cervical mobilization produces immediate short-term improvements in neck pain, according to Gross et al. 2010. Maitland mobilizations provide immediate and sustained 12 weeks reductions in chronic cervicogenic dizziness, according to Reed et al. 2014. There was a greater cervical spine range of movement in 4 directions for the passive mobilization group compared to placebo. There were no adverse effects, and these results provide evidence that mobilizations have long-term beneficial effects in the treatment of chronic cervicogenic dizziness, according to Reed et al. 2015. Interestingly, Lee et al. 2005 found that posteroanterior mobilization of the cervical spine produced extension of the upper joint and flexion of the lower joint, as opposed to an actual posteroanterior glide of the vertebrae. This being said though, the effect of mobilization is more neurological than mechanical, so the motion may not matter as much as previously thought. This is a Maitland mobilization technique of the cervical spine and can be applied to all cervical levels. However, C1 is difficult to palpate, so is C3, due to the large C2 spinous process overlapping slightly. Technique. With the patient in prone, the therapist stands at the head of the bed. The therapist places their thumbs together and places the thumb pads onto the desired spinous process. The fingers of both hands lightly wrap around the neck for slight stabilization. For C1 and C2, the patient is best in a slightly retracted neck position. For C3, slight flexion of the neck may be beneficial, but C4 to 7, there will be no problem palpating. Next, push in a posteroanterior direction over the spinous process that you want to mobilize. The tendency is to push too hard, so be careful not to do this. This is a Maitland mobilization, so use the Maitland mobilization grading system for the technique. Grade 1, small amplitude near the starting position of the range. Grade 2, large amplitude. This is in the free range where no stiffness or spasm is found. Grade 3, large amplitude. This is moving into stiffness or spasm. Grade 4, small amplitude, stretching into stiffness or spasm at the end of range position. Snodgrass et al. 2014 found that a larger applied force appears necessary for reducing stiffness and potentially pain in patients with chronic neck pain. Changes were not observed immediately after mobilization, suggesting the effect is not directly mechanical. The rhythm, speed and duration may vary due to the fact that systematic reviews of manual therapy for neck pain indicate that research is needed to determine the optimal treatment characteristics and dosages of manual therapy for effectiveness, according to Snodgrass et al. 2014. This being said, it is common practice to perform several sets of over 1 minute of mobilizations. Here is the technique performed again, but on a model spine to show you what to feel for.